talk for today is by Kristen McCullough, who's a pharmacist, and it's about counseling patients with myeloma, tips from a pharmacist.
All right, thank you for the introduction. I will try and, I don't know if I can quite get you back on schedule, but we'll see what we can do. I don't have any disclosures, and I'll talk briefly about some off-label drug use, but Dr. Gertz did a great job doing peripheral neuropathy, so I think we'll just skip that. Objectives today, I'm going to talk a little bit about how I approach discussing multiple myeloma agents with patients, and the structured approach mostly because the patients that I see kind of look at me with a deer in the headlights appearance. They don't understand what I'm talking about, where all these drugs are coming from, why they're different than other patients, et cetera. So I kind of have a piecemeal way of looking at it. I'm going to discuss management options for some of the non-hematologic complications. You guys are all pros at the hematology portion. So we'll touch on rash, muscle cramps, nausea, vomiting, constipation, diarrhea, and then infusion reactions. And then as a pharmacist, I would be remiss if I didn't talk about adherence, because it's coming from the standpoint that we used to do everything as putting a patient in a chair, and an infusion is something you had control over. Either they showed up to the appointment or they didn't, so you knew what they were doing. But when you send somebody home with oral medication, you no longer have control over what they're doing on a day-to-day basis. So from a patient standpoint, their biggest question is, what in the world are you starting me on? This is completely confusing, and I am way out of my league. So I usually use something to describe it to patients that's very American. So we're very food-centric. So we talk about this as a dinner plate and taking your dinner plate to a buffet. And so everybody starts at the plate, and on your plate is generally corticosteroids. Everybody has a plate, but when you go to a buffet, perhaps you can only choose one thing from each category. You can only choose a meat, you can only choose a vegetable, one starch, and one dessert. And for patients, that's one thing from every category, and they oftentimes better understand it if you can tell them it's one thing from each category. So if the person that they're talking to next to them in a chair in an infusion center is getting something different, they have an easier time understanding why their choices are different from the person sitting next to them, because they can't all have duplicates from multiple categories. And then, of course, you all layer on top of that the importance of their current disease states, if they have toxicities, if they have concomitant conditions, drug interactions, transplant eligibility, et cetera. And for a patient, all of those other decisions are the same decisions they would make if they went to a buffet and said, I have preferences in any of these categories, I have allergies,